A urinary catheter is a thin, flexible tube used to drain urine from the bladder. It is inserted through the urethra, the tube that carries urine from the bladder to outside the body. Catheters are used when someone cannot empty their bladder naturally. This could be due to surgery, illness, injury, or blockage. Catheters are important in medical care. They help prevent complications from urinary retention like bladder damage and infection. They also provide comfort and improve quality of life for people who have difficulty urinating. There are different types of catheters to suit individual needs. Each type is designed to address specific medical conditions and patient requirements. Intermittent catheters are used for short periods and removed after the bladder is empty. These catheters are typically used several times a day and are often preferred for their convenience and reduced risk of infection. They are commonly used by people who have difficulty emptying their bladder due to conditions like spinal cord injuries. This method allows for greater independence and can be managed at home with proper training. Indwelling catheters, also known as Foley catheters, are left in place for longer periods from days to weeks. These catheters are often used in hospital settings or for patients who require continuous drainage. They have a small balloon that is inflated inside the bladder to hold the catheter in place. This ensures that the catheter does not slip out and provides a secure method for continuous urine drainage. Foley catheters are commonly used after surgery or for people with urinary incontinence. They are also beneficial for patients who are bedridden or have limited mobility. Suprapubic catheters are inserted through a small incision in the abdomen, directly into the bladder. This type of catheter is often chosen for long-term use or when urethral catheters are not suitable. They are used when the urethra is blocked or damaged, or if long-term catheterization is needed. Suprapubic catheters can provide a more comfortable and manageable solution for patients requiring extended catheter use. Proper care and maintenance of your catheter are crucial to prevent complications. This ensures that you stay healthy and avoid any potential issues that could arise from improper handling. Keep the catheter clean by washing your hands thoroughly before and after handling the catheter. This simple step is essential in preventing the introduction of bacteria and other pathogens. Clean the catheter and the area where it enters your body with soap and water daily. This helps to remove any dirt or bacteria that may have accumulated, reducing the risk of infection. Keep the drainage bag below your bladder. This positioning is important because it uses gravity to help urine flow out of the bladder efficiently. This helps urine flow out of the bladder and prevents it from flowing back up into the bladder, which can cause infection. Drink plenty of fluids such as water and other hydrating beverages. This helps flush bacteria out of your bladder and prevents urinary tract infections or UTIs. Staying well hydrated is one of the simplest and most effective ways to maintain urinary health. Watch for signs of infection and contact your healthcare provider if you experience fever, chills, pain, burning, or foul-smelling urine. Early detection and treatment are key to preventing more serious complications. These could be signs of a UTI. Always be vigilant and proactive in monitoring your health to ensure the best possible outcomes. Living with a catheter can be an adjustment, but with the right information and support, it can be managed effectively. It's important to educate yourself about the process and seek out resources that can help you navigate this new aspect of your life. Managing daily activities is important. You can still enjoy many of the things you love, like cooking, walking, and even doing household chores. The key is to find a balance and make small adjustments where necessary. You can generally continue with most of your normal activities while using a catheter. Whether it's gardening, playing with your pet, or working on your computer, life doesn't have to come to a halt. However, you may need to make some adjustments, such as wearing loose-fitting clothing and emptying your drainage bag regularly. These small changes can make a big difference in your comfort and convenience. Hygiene is essential when living with a catheter. Keeping the catheter area clean can prevent infections and other complications. Wash your hands frequently, especially before and after handling the catheter or drainage bag. Proper hand hygiene is one of the simplest yet most effective ways to maintain your health. Shower or bathe as usual, ensuring the catheter and drainage bag are kept dry. You might need to use protective covers or other methods to keep the area dry during your hygiene routine. Intimacy doesn't have to be affected by having a catheter. Open communication with your partner is crucial. Talk to your partner about any concerns you may have and discuss ways to adapt to the catheter. Your relationship can remain strong and fulfilling with mutual understanding and support. Remember, your healthcare provider is your best resource for any questions or concerns you may have about living with a catheter. They can offer personalized advice and support to help you manage your condition effectively. Thank you for watching, and don't forget to like, share and subscribe for more valuable content. Stay strong, stay healthy, and stay informed.